If you're someone who is suffering from varicose veins, deep venous thrombosis, or symptoms such as leg pain, swelling due to increased weight gain, then I have some very valuable insight for you today. It is the use of a fairly easily available and fairly easy to use medical device which are known as graduated compression stockings. So what exactly are these graduated compression stockings? Well, they are like your daily wear socks, except for the fact that they apply a certain amount of pressure on the calf muscles. Now, as you may be aware that these calf muscles, they are the main reservoir of blood in our legs. And if we offer adequate compression to these muscles, then the venous return, the blood return improves, thereby helping patients of varicose veins, deep venous thrombosis, and also those who are overweight and have symptoms such as leg pain or leg swelling. Now, where do we exactly use this compression stockings? Varicose veins, DVT, symptoms such as pain, swelling, I have just now mentioned. But you'll be surprised to know that they are helpful even in pregnancy-related leg discomfort, even in those patients who are having swelling to some extent following prolonged surgeries, prolonged hospital stay, and also in patients who are recovering from cellulitis. So these patients, they tend to have some edema, some swelling which is persistent. So even in these cases, these compression stockings are of great help. Many of my patients ask me whether this something known as Crepe bandage, whether this is really useful, whether it can substitute for compression stockings. Well, the answer is no, because for the blood to return from the legs to the heart, we need a certain amount of pressure, which is not given by this particular Crepe bandage. Also, whenever we apply the Crepe bandage, it tends to get loose over a period of time. So it doesn't really serve the purpose. So if you're thinking that Crepe bandage will be a substitute to graduated compression stockings, then the answer is a big no. Many of my patients ask me whether they can purchase these stockings over the counter, online. Well, of course you can, but there are certain things that one needs to keep in mind. First and foremost, the stockings which are offering graduated compression, they need to have class 1, class 2 or class 3 written on them. Now, what is this class 1, class 2 and class 3? Well, it signifies the amount of pressure that is being applied by that stocking on your calf muscle. So class 1 will deliver a pressure of somewhere around 18 to 23 millimeters of mercury. Class 2 from 23 to 32 millimeters of mercury. And class 3 is anywhere above 32 millimeters of mercury. Of course, your doctor will be able to inform you as to where these class 1, class 2 and class 3 can be used. But for someone who is having varicose veins with symptoms, I think class 2 is a good bet. There are also below knee stockings available, above knee stockings available. Above knee stockings are a bit difficult to don, that is to wear and to remove. Below knee ones are fairly easy. So if I have a patient who is slightly elderly or maybe obese and has difficulty wearing the above knee stockings, even if you wear the below knee stockings, it is okay, because that is going to compress your calf muscles and is going to give you benefit. But please ensure that your stockings are the right graduated compression stockings. So these are the graduated compression stockings that I am talking about. The commonest query by my patients is, Doctor, how do we really use these stockings? For how long do we use these stockings throughout the day? Well, the answer to that is you have to wear these stockings right in the morning before the swelling in the leg begins. So probably a practical thing to say would be the moment you up from the bed, you finish your morning chores, you get ready for the office, that is the time where you wear the stockings. And the stockings need to be worn throughout the day, be it sitting, be it standing, maybe around 8-10 hours. I have patients who wear them even 12 hours a day. And believe me, they give fantastic results. The pain, the swelling really goes down. Now, though I am advocating these compression stockings very strongly, there are many minor issues or problems that come up. So sometimes the patients, they tell me that these stockings are very tight. Well, they have to be tight so that they give enough amount of pressure for the blood to return. But then if they are too tight, then probably the measurement isn't right. So one has to measure the circumference or the size just above the ankle and at the mid calf for the below knee stockings, and if it is an above knee stockings, even the mid thigh circumference, to get the size right. So first ensure that the size of the stockings is right. If it is, then I don't think you will have excessive pressure. Apart from that, one of the another common complaints is they give a lot of itching towards the end of the day after removing. Well, in conditions, humid conditions like ours, it does happen. The solution to that is applying ample moisturizer to the leg in the morning before wearing your stockings, and then wearing them. And the moment you remove them in the evening, just wash it away with some cold, lukewarm water, whatever suits you best, and apply the moisturizer again, and that will take care of the itching part as well. I hope you have found the information to be useful. Graduated compression stockings are really helpful if you are suffering from varicose veins and the symptoms related to it. But please remember that these stockings are only to tide over the crisis. That is, if you want to buy some time, if you want to postpone your treatment, the actual treatment, then the stockings are really of great help. But they are not a substitute to the actual treatment of varicose veins. This is very important to remember, because I have come across instances wherein patients have delayed the required treatment of varicose veins indefinitely. They have used stockings on and off, and despite that, they have landed up with complications. So yes, graduated compression stockings are of great help, but it is very necessary, very important that we use them wisely.